to better and better communicate health information. So to start off, there are some logistics. We'll have a period for questions and discussion at the end. I don't expect this to take the full hour. So first, I'll tell you a story. The reason I want to start with this is last Friday I was, posting on graphic medicine and the work we're doing here at the library. And the question I kept getting asked was, how did you come up with this idea? How did you think of using comics in medicine? Well, the answer is it's not really my idea that I came up with. We'll get to that later. What happened is I was conducting a day interview at a medical library, University of Kentucky actually, and one was looking for medical images. It was a very logical kind of question, and I was stumped, so I do what every millennial does and jump to try, and came across a website called Graphic Medicine. Oh, give me one, I'm sorry. I got to figure out the PowerPoint. I'm sorry. But so I went around for graphic images, and lo and behold, if this is not what we were looking for, but I discovered this website called graphicmedicine.org. It's put together by Williams, a physician out of North Wales, and M.K. Serswick, a nurse. She's out of Chicago. I can't remember her exact institution. It's on the screen there. But this came about because Williams was doing a master's in medical humanities and started thinking about how comics might be used in medicine. You'll see in some stories like Daredevil, there's medical information in there. Then the one that speaks most to me that I remember from my childhood is Speedy from Green Arrow. He's a drug addict, and it takes over his life, and it's a very powerful, emotional story. And you don't see that so much in mainstream superhero comics anymore. But that's what got me thinking about this and more. So I came across this idea. So we'll jump into it, if I can convince this to go forward. So definitions, best way to start anything, I think. Graphic is defined as the intersection of the medium of comics and the discourse of healthcare. That's how Williams has been defining it for the past decade. It is not the only definition or only way to conceive of graphic medicine, but it does have a nice, concise academic definition feel to it, so it's the one I generally run with. Then there's a question of exactly what a comic is. This is a definition that is highly contested. Studies has been wrestling with what exactly a comic is and how to describe it for as long as comic studies has existed. But I like this one. Scott McCloud says comics are comprised of juxtaposed pictorial and other images in a deliberate sequence intended to convey information and or produce an aesthetic response in the viewer. Comics are images and stories put together in a way that conveys information and or causes you to feel something or have some response to it as a piece of art. I want to pause for a second here with these definitions and ask you all listening if you can think of any problems with them. And I'll wait a second to think on that and post it in the chat, and then I'll tell you some of my issues might be. looks like you all are having difficulty sending chat messages to everyone, but I have been getting a bunch of answers. So, concern about always linear, differences. Comics are not always a sequence. Sometimes they're one panel. That's actually the biggest critique that I hear from Scott McCloud's definition, is that it exclude, even political cartoons. Let's see. Two definitions. Movies. That is something that comes up often, that definitions, where does a comic and an animated movie? Questions that comic scholars have been wrestling with for a long time. And I'm not going to pretend that we can answer them here today, but so a lot fit into, I have three categories of issues I take with these. First one is broad. Both the definitions are extremely broad. They could be about animation, for example, with comics. I personally see a big difference between an animated movie and a comic book. We process that kind of information differently. We don't process what you see on a screen or what you watch on Netflix every day the same way that you do when you're reading a comic. And you even wonder what exactly healthcare means. Include everything from nursing to dentistry, public health. Is that healthcare? There's questions floating around about what the healthcare is in social justice movements and how far those things can intermingle. These definitions are, also kind of narrow. You under Cloud's definition, single panel comics, are they excluded? What about wordless comics? Does a comic need to have words in it to count as a comic and convey information? I personally think not. Action's run on Hawkeye recently included several issues where he was depicted as deaf, and the comics were wordless, and there was signing involved. But there aren't words, so some definitions that would have to be excluded as a comic. So those definitions are failing somewhere because it clearly is a comic. A fantastic one if you haven't read it yet. And definitions are attempting to be subjective, but they are attempting to be objective, but they really leave us with a lot of questions. What is graphic medicine? What is not graphic medicine? And wrote in my notes for myself, thinking about this as I'm going through the process of review information, the canon. A lot in literature studies, what is the canon for this area? Whether or not a canon is necessary or even beneficial, it does roll in how we collect material in the library. Every public library is going to have certain titles that are necessary and required for that collection to be considered complete or appropriate. Definitions of what is and is not graphic medicine are subjective. Can we actually have a canon? What exactly does graphic medicine have to do with librarianship or medical librarianship? See these four major points. That's what I'm going to spend some time on. There are others. No way to hit all of this in one go. These are conversations that I hope that hopefully this webinar will kickstart conversations and discussion, and we can see exactly what role we imagine ourselves here. Literacy, consumer health, medication, and then a research and discovery component. All are things that we deal with on our day-to-day, in our day work life, to various degrees, depending on if you're in an academic or a consumer environment. So for literacy, background, to spend a lot of time on this because many of us here are librarians. We know issues of health literacy, but some statistics that always strike me. 0% of U.S. adults are considered proficiently health literate. That's according to the Department of Health and Human Services. They have much more information on there that is great and everyone should take a look at. But when that strikes me is I'm from a state where in high school we had standardized testing, and if school came out as 12% proficient, we had state investigators, we would have funding cuts, it would be a nightmare. So for only 2% of U.S. adults be considered health literate, that's a major problem that healthcare and librarianship need to find a way to attack and target, and are in many ways, and to varying degrees of success. I'm proposing that comics are another way we can try to address that. Visual literacy, though, that's something we're probably not all as familiar with. I tried to find a definition that I thought would cover all the bases, that wasn't subject-specific, that wasn't specific just to educational theory. But almost all the definitions of visual literacy are specific, or they don't really capture what I want them to. But the gist really is that visual literacy is the ability to accurately interpret visual images, to understand the context of those images, to be able to interpret their meaning. This is reading infographics, reading comic books, understanding the role that language plays in a comic panel in response to the words. I was recently watching a TED Talk talking about the differences of converting Watchmen from the comic book to and Rorschach's mask. For those that don't know, this character wears a mask that is constantly changing into different Rorschach blot tests. In the comic, it's a static image because the medium demands it to be a static image. It changes from panel to panel, but you can associate that Rorschach image with the wording in the panel in a way that can't necessarily do on a visual screen. But visual C deals with both of those things, to understand that kind of a context. And as is well aware, we are in an increasingly visual world. Snapchat is basically the social media tool of choice for younger and younger people. It is primarily just visuals. My life has basically been surrounded by memes, and if you don't understand how to work, you're going to be a little lost in the landscape now. So much that ACRL approved visual literacy competency standards in 2011. I've been some round of the standards in ACRL. I'm not entirely positive on how their visual literacy standards are affected. There are a number of studies out there. If people would like some on this, reach out to me after the webinar, and I can send you links. Now, primarily, this is in education research. Discussing using comics to teach kids to read, teach kids secondary languages, teach kids who are not native English speakers English. There are kinds of uses for comics in education, and we're just now starting to see that trickle into healthcare and our discussions around health literacy. As I said, we're just now getting to those discussions. Here are just a couple of studies that I refer to regularly when talking to people about comics and health literacy. All of these public health, consumer health kind of studies about using comics at childhood obesity. These often talking about manga or comics are basically, or they're Japanese comics. They read a little differently. Some of the tropes, the narrative tools are a little different. That goes back to that cultural component that someone mentioned. Kind of tools are one of our authors is here. That's awesome. A lot of different ways to go about this. I really just want these. There are a few articles about this study using manga in education to influence parents' behavior through their children. it's a little complicated. I'm not entirely convinced that they can draw real conclusions with the data they have yet. But one on stroke awareness is talking about having middle students, junior school students, manga that informs them about stroke markers and evaluating how those conversations with their parents happen. We recommend looking into these. So there's a lot there. Before on to talking about consumer health, I wanted to show this comic about what is a graphic novel, what is a comic book, how do you read them. I discovered this while looking for an easy way to try to address this question. I have people regularly, far more often than I would have ever thought, mention to me that they're unsure of how to read a comic or not sure how to follow the panel flow, and I can understand that. Thinking about it now, if I had to pick up a complex novel like Epileptic by David B., some of those panels are very difficult to follow because that's the way he basically illustrated it, to follow the flow of the story. The visual flow reflects the nature of the disease he's talking about and the experiences he's memorializing. But so this short page comic, this is just the first page of it, put together by Jessica Abel. Use the link here. This PowerPoint will go out later. You can use the link here to get the rest of the comic. And for yourself, there's actually a poster version of it, and she's made it CC BY, so you can share it in your library. Available to everyone to use. So, less on more of the what are we actually doing here. Librarians, as all of you are aware, we're regularly engaged in providing timely, evidence-based medical information. Few of our patrons can actually understand our scholarly work. They're filled with jargon. They're far above an 8th grade reading level that is the national average. There's a great number of studies on that as well. Some of even our consumer health websites fail to meet the standard of readability for our patrons. And we have the ways to deal with that, to engage them in a way that they can understand. Part of it for me is that people really like stories. That's another one. I was trying to tell that story earlier. How did you come up with this? How did you think of this? People don't just want information thrown at them. The context of a story makes things relatable and understandable. Break down into chunks that people can actually experience. And for some people, there's the idea of bibliotherapy. This is not a new idea. It's been going on forever. And working with a colleague to put together a presentation on the history of bibliotherapy and where graphic medicine might fit. And a lot of this is based on Sarah McNichol's work. She's got a few articles out there discussing bibliotherapy and the power of narrative medicine. And she started touching on graphic medicine as well. This link here is one of the articles I think gives a good baseline for that information. So what you can go about consumer health, a lot of things that actually means. So I've got a few comics in here that I'm going to try to explain where they might fit. This one here is a series of comics about diabetes, keeping healthy. It's from Kathy Leamy. She works at Mass General Hospital here in Massachusetts and Boston. They recently put a series of these together into an actual floppy comic. It's about 30 pages that they have available in their Diabetes Education Center. These are really meant to be short, inspirational, you can do it, stick to it kind of comics that say a lot of medical information, give you the body language to help understand and relate to what chaos it is. Like waking in the morning to work out. I know I can't do that because, I need 12 ounces of coffee to even get out of bed in the morning. So these kind of comics can relate to those concerns. And this help tell that story and give that information more than words alone could ever do. One here, it's very busy. You see a drastic difference between this comic from MetaKids talking about melanoma versus the diabetes we just looked at. These MetaKids comics are meant for kids, and it's a series of comics covering all kinds of topics. I think they're up to like 40 books now. Recently, the company has changed a little bit, and it's a little hard to find the comics right now. But this is great work. They've published a couple of papers on how kids respond to these comics, evaluating how the information actually transfers to the kids, and that the research seems to suggest that comics work better than words alone or just having a conversation. They relate to the fun, crazy images. I really think this is a little busy, but if I were, 8, it'd probably be awesome. One of what I would probably say is one of the most famous of graphic medicine titles is Mom's Cancer by Brian Fies. He actually was the first person to win an Eisner Award for a webcomic series. This comic series was eventually turned into a print book. The first graphic medicine titles I ever read and discovered. And it really does a fantastic job of showing the experience of medicine from a patient and family perspective. He's memorializing his experience, work with his mother and his family while she's going through cancer. I love this panel in particular, the series of panels in particular, because it shows just how chaotic and stressful and not user-friendly the medical experience can be for patients and families. Simply to schedule appointments or even find out your test results can be a nightmare. And this is something that anyone that's ever had major surgery or major illness can relate to, and it really draws you into it. And I put this one here sort of at the last moment. I won't spend a lot of time on it. This one in particular, I had this comic to give to people when I was a teenager. My personal medical history is I deal with chronic pain, and this comic helps explain to people what pain actually is and how it affects the body, and something that is easily explained to someone who doesn't deal with it. So it takes all of that clinical language, clinical studies, and puts it into images and words that people can really understand and relate to. It's called It's Really Strange. This is one of Singing Dragon. It's an imprint of Jessica King Publishers doing medical comics. This one's about 30 pages, and it includes full reference information of how they found this, how they found the medical details. Highly recommend everyone take a look at to get an idea of what medicine is capable of. Okay, so leaving health behind, moving forward. In academic medical institutions tend to be very involved with medical education. Some of us are on curriculum committees, others are doing systematic reviews for our researchers. So think about medical education. 4 major areas that I really think to be pointed out. Is one, formation is another, illustrating the physician experience, and then the value of comics as an educational tool. I'm not going to leave this slide. I'm going to move forward to some more comic examples that I think will help illustrate me. This is Mom's Cancer again. I tried to find something else that really hit on this empathy point better. This was my favorite one. There are these that show that by the 3rd year of medical school, ability to empathize with their patients, to empathize with people is diminished, because the understanding is that the first 2 years of medical school are so clinical, so learn hard science, that it becomes mechanistic. It starts becoming more difficult to see patients as people instead of as just them. The link that Blanc just posted in the chat is a great one for this. Um, and so, something like mom's cancer, if you hand this to a medical student and they read this, maybe it will force them to confront the humanity of medicine again, to understand why the patients might feel that the system isn't working for them and it's against them. And formation is one where you don't have a specific comic to throw up there because there are so many. This is a screenshot of a collection of graphic stories from Penn State Medical College, College of Medicine rather, where Mike Green has been teaching medical students for about 8 or 9 years now, on graphic stories. And one of the assignments, the result is about an experience they've had as a medical student, and just literature on this talking about how they're a valuable tool for medical students in their formation of their identity as a physician. Some of these stories are about being a medical student and feeling overwhelmed, and others are about third and fourth years understanding that transition from student to practitioner, from layperson to doctor. I highly recommend checking them out. And it's something that I think is easily replicable across medical school curriculums. Okay. The physician experience is one that I'd like more of in graphic medicine. What here are, this is a panel from The Bad Doctor by Ian Williams, about a physician who is struggling with obsessive-compulsive disorder, feel overwhelmed by his patient load, just with life in general. And this is a panel I thought that really captured that frustration and that feeling of being burnt out. That's talking to him, and he's sort of kind of listening, and then someone naturally interrupts him when he tries to collect himself and has to run out and deal with something else. That chaos. And in these kind of stories might allow patients to actually empathize with their physicians. There's a lot of study about why physicians may lack empathy towards their patients, but there's also a problem with physicians with not empathizing with their patients as humans as well. And the right is from M.K. Serswick. So we've got both of the founders of the Graphic Medicine website here. And this book comes out in about a week, I think, and it's MK exploring her experience, telling stories about her time as a nurse on an AIDS ward. I'm looking forward to this one. It'd be a powerful experience into a world that those not working directly in healthcare don't normally get to see or understand. Educational tool, I couldn't really put picture comics on here for reasons I'll talk about later. But these are some links to valuable on using comics as an educational tool. First one talks about using comics. They're short little 2-page comics as preparation for a difficult subject in a medical school class. The students really loved it. It gave them an idea of what to actually pay attention to and what was valuable. Think of it like a visual summary. Second is about using manga in medical education. It's more talking about theoretically using manga in medical education because this is still a new idea and not a lot has been published out there. Third one was recently talked about on BBC4 Radio, and these are showing that students retain information material presented in a comic book format better than traditional textbook formats. This is I think the study is based on a textbook about biological psychology that I reviewed earlier in the year. It's great. I personally am never going to study biopsychology, but it's still interesting to read because the comics drew me in and what it can do for someone that's actually intending to study that field. Okay. So that was medical education. And now research and discovery. these are two separate things that are important and valuable that could in their own separate categories, but for the sake of brevity and the sake of, frank lack of published information, we're away with it. For the research side, graphic medicine is still an emerging field. That's part of why there are so few studies out there. Because it's a humanities field, some of it is difficult to measure. How do you measure identity formation in a way that meets scientific standards? That is people not understanding how humanities research works. Another role for librarians here is making that kind of distinction clear. And the studies are small or narrow, between 10 and 100 people. Most of the time, those populations are studied once and not revisited later. That's a problem in all of research right now. But for something new, and something humanities-based, that's going to get a ton of criticism to begin with, that can be something difficult to handle. There are opportunities for librarians to get involved. Like before systematic reviews, we are ideal people to take part in teams of doing research, whether they're systematic reviews or otherwise. We can find this information, put it together in a way that's easily readable and accessible, so we can move forward with their research projects. Or take the lead. Anderson, she's been in chat as well today. Recently, this study with a team of researchers on building empathetic communication. I believe the article is open access, so everyone should be able to see this one. And it led a great chat on Twitter the other week talking about how effective the comic was and how you can see that being valuable in settings and using that to build empathetic communication between patient and physician going both ways. On the library side, I apologize for the wordiness of this slide, but that's just what this one had to be. As a research into this is minimal, what does exist can be rather difficult to find. At the moment, I'm working on a scoping review to discover what's out there and see where graphic medicine is at the moment, because it hasn't been truly cataloged yet. And what I'm discovering that our mesh terminology for comics is not really working. The term that usually gets applied to comics is cartoon as topic or caricature as topic, and caricature is one of those things that I wouldn't consider a comic. Others might, but those terms are very broad, and much of the literature in those mesh headings has nothing to do with comics or graphic medicine. Searching keyword, you can see comics with an X. There are sequential narratives, graphic novels. All these words bring you a information, a dearth of sources that have nothing to do with graphic medicine. But as of right now, that's really the only way you can search it out and find it, unless you know exactly who published and what. End of each of these, I've asked us some questions for us that we can maybe discuss later. How can we as librarians use our expertise to improve the findability of these studies? We need to rethink our terminology. Maybe we need graphic medicine or comics as a mesh term, but then it doesn't get back indexed. So we have to consider how to do this. Comics rated for research studies often disappear. For example, the study from 2 slides back on empathy and communication by Patricia Anderson, the Journal of I think it's a Journal of Clinical Radiology, actually published the comic itself with the paper, and that's very, very seldom the case with these studies on comics. The comics are neither included with the published article, nor you directed on to a location to find the comic to evaluate it or reuse it for another study to confirm the findings. And that's something very tricky with this, because the quality of the comic being studied could have a big impact on the effectiveness of the comic for what it's measuring. If you have a comic that is poorly scripted, then, and your results say, well, the content work, people didn't understand what we were asking them to understand, then of course that's a problem because the comic was bad. Maybe the problem is the comic, not the comic itself being studied, not the comics itself as a whole can't convey information. Well, I'm exploring and thinking about is maybe there's a role for libraries to somehow collect and store these comics being used in studies. The same way that where the National Library of Medicine is working set curation and making those available, and in some areas requiring data to be made publicly available. Maybe that's something we need to consider for comics as well. There are a lot of issues to tackle there, particularly copyright, because most of these comics are not being created directly by the researchers. It's an art that has been brought into the team, and it can be tricky to mesh all that out. And finally, our big role as libraries, our biggest thing is our collections. Something I'm looking at since I discovered graphic medicine is are these books finding their ways into public or medical libraries? And the answer, for the most part, is no. You'll get titles like Mom's Cancer is in most public libraries. The Graphic Medicine Manifesto, which is like the now academic text on graphic medicine, that's finding its way into most medical academic libraries now. Really, other than the big hitters, there aren't a lot of medical comics out there. So we need to ask ourselves about building these collections for graphic medicine. How do we market them? How do we make them discoverable? How do we get the word out to people that this is something that they can use that might benefit them? One I like to highlight on a regular basis is the district library, the public library in Ypsilanti, Michigan. One of the first libraries to get a Will Eisner graphic medicine grant, or not a Will Eisner grant from the American Library Association, and they used that to build a graphic medicine collection. You can find it on their website. They also are running book clubs and they had a speaking event and doing a great job with graphic medicine. And to my knowledge, that's the major public library collection out there. Of course, I'm likely missing things. Our library collections are not usually the most findable unless you go to our websites. So, Ed, I want to stop for a minute and talk about a unique kind of graphic memoir that got published last year. It was published via Kickstarter, which is a common occurrence for a lot of independent comics now. Raised on Ritalin by Tyler Page. It is unique in that it's both a memoir about growing up from childhood to adulthood with ADHD, and very well-researched historical account of ADHD and the industry that has grown around it. It's a bibliography. The final version of the bibliography is the one in this link here. Some of his citations didn't make it into the published book I recently discovered, so he's made this available permanently on his website. And it's an example of what graphic medicine can be. It combines all of the elements that you want to see in a memoir talking about medicine. It's got the human experience. It's got the research. It's got a gripping, kind of draws you in. The illustrations are fun. They don't make you depressed because he's dealing with a rough topic. I suggest checking it out. Deep breath, more coffee. Really where I am at the moment with breaking out graphic medicine, the areas I see that it can fit in with our work. I know the others, and I'd love to hear about things that people are doing. I see some conversation in the chat I'll look at later. But to keep up to date with graphic medicine, this has really just been a throw-it-in-your-face overview, and there's a lot out there. First stop will always need to be the graphic medicine website, graphicmedicine.org. MK and Ian do a great job of keeping things posted. There's a podcast that MK runs with creators and scholars. There are reviews up there. And the media is where I find a great deal of going on, because not everything makes it into published literature or an article that you can find via Google. So I put this list on there, if you use that can help you see who's posting a lot about graphic medicine and who to follow and see. Far from complete. There are probably errors, but an ongoing project. The graphic medicine Facebook page, that's where it's the Facebook page for the graphic medicine website, but things get to there more often than on the website. Articles or upcoming events or interesting news coming out. It's a good place to keep track and easy to follow. And then self-promotion. I hate doing it, but I am running this graphic librarian blog. Primarily, it is there for research that I'm doing with graphic medicine. Once a week, on Fridays generally, I collect all the graphic medicine goings-on that I find and am aware of for that week. It's a lot of tweets, a lot of links to webcomics and to research and conference information and calls for papers to various books and chapters and everything I think of. I try to capture that week and post it on days. And keep doing that for the foreseeable future. There's a large bibliography on there. I think the page is called Graphic Medicine in the Academy. And it's a large list of citations. As I find them doing the scoping review, I'm posting them on that site. That way they're out there for everyone else to see. That way you're not recreating or redoing searches that I'm spending hours going through. They're available for everyone to use. And here's a plug for the Graphic Medicine Conference coming up in Seattle this June. It's June 15th to the 17th. I recommend trying to attend if you can. The registration, I think, registration goes up on March 18th. Conferences have been relatively reasonable, especially compared to our medical librarian conferences. This is more like $100, $150 instead of nearly $600 like MLA. And this year they're doing a special session for librarians, a brown bag session that MK is helping to lead on March 16th. Not 16th. That's June 16th. Thank you guys for fixing it in the chat. I apologize. That's why I'm making this minute-ish. The brown bag will be on June 16th, and that's part of that is because the Pacific Northwest region of the Network of Libraries of Medicine is helping sponsor the conference this year, and so they're helping run this brown bag session so we can all learn about graphic medicine. So that. This last couple bits going to be what I've been up to, what's going on in our library and with the New England region. We have our own graphic medicine collection here last fall. As of, I updated this WorldCat listing this morning. We are, I believe, at 63 titles. It's 65 or more once a couple of books that are on order get here. It's pretty popular with our medical students. Popular ones are The Bad Doctor. That title just grabs them and they get really curious. December, we hosted James Sturm. He's the director of the Center for Cartoon Studies in Vermont, and they've been working with White River Junction VA to a series of veterans at the VA. Some of them are medical, some of them are not, but they're kind of social situation, how they deal with re-entering non-combat society. Those things all do have impacts on their health. And it's a great partnership going on. And this year, I I'm co-teaching a class for our third-year medical students, modeling it off of Michael Green's work best I can. He's got a longer period. We'll have a week on graphic medicine, how it's to health literacy, and how our students might use it in their practice. And drum roll, as of today, as of the webinar, the New England region of the NLM is launching this book club kit program. What is we have 10 topics, range from addiction to grief to veterans health. Each of these kits include 6 copies of a graphic novel of that topic, one of our graphic medicine titles. And loan these kits out to organizations within New England. They're out for 6 weeks at a time, no charge. The idea is to allow organizations to use graphic medicine within their community to see how it works for them. Libraries might even borrow it. The idea being, if you're not sure a graphic medicine collection would work, you could borrow these kits, give it a try, see what the interest is like, see what it's all about. They include the books, discussion questions, kind of an overview of the titles and what graphic medicine is. And the website is now live, so you can click that request button and request a book kit if you're in the New England region. Right now we're limiting it, that. All right, so that's all I have. A lot at once. So I want to thank you all for coming and see if any questions. Put them into the chat. And Mark, if I missed any earlier, can you let me know?
Hi, Matthew. So we did have one question that I don't think went to everyone, and that was, would Noe and Risky, I'm sorry, I'm going to mess up the name, Notebook of Nursing, a collection of images and mnemonics to increase memory and learning, would that be considered a comic?
Let's see if I can find it. Nursing, collection of images. Familiar with that one, and I think it would depend. So this is where missions get questionable. My instinct is if it is a series of images, pictures, photographs, hand-drawn, etc., that tells a story, a consistent story that makes sense, I would call it a comic. For some of these, this goes back to the cultural question someone asked earlier or brought up earlier. There are these things called photo novels or photo novellas. I'm considering them comic books for the sake of our scoping review, but they're more photographic stories that people put together that narrative. Like imagine someone is dealing with cancer and they photograph their experience. And then they put it together in a book, and they add some word narrative in there to get flow and fill gaps that the photos leave out. I would call that a comic, even though there's not any illustrative drawing in there. So look into that specifically and see what it looks like.
Earlier comments that I don't think went out, or comments that went, I don't think went out to everyone, which is about the difference between graphic novels and comics, and I don't know if you wanted just a little more on that.
So the term graphic novel is primarily a publishing term. Graphic trade paperback, hardcover omnibus, these are primarily publishers' terms that denote different ways that comics are printed. Like I use them interchangeably. For all graphic novels are comics. Personally, would say that but not all comics are graphic novels. Comic that never gets printed in physical format is probably not going to be considered a graphic novel. A novel gets critiqued all the time because technically most of what we're talking about in graphic medicine are not novels, they're memoirs. So terminology definitely gets confusing. My response is I use graphic novel when I'm introducing the topic to someone because to be a little more weight behind it. It doesn't have all the baggage that the word comic has. When you say graphic novel, most people's first thought is mouse. No one's going to debate whether Art Spiegelman's Mouse is a literary masterpiece. No one's going to argue with that. So people immediately put respect behind it. When people that work with on a regular basis, everything is comics, because I just think it gets cleaner and really gets the point across. So I'm not a question. I don't think there's a clean answer, but that's where I sit on that distinction.
So I'm just going to keep feeding you questions because I don't know if you're seeing them. But so with your catalogers to create more specific subject fields for your graphic medicine collection?
Okay. So the answer is no, and is because we don't actually have specific catalogers. Speaking, the cataloging that happens here is done by myself or another library fellows, and we do what we can in our best, and we work with our veteran WorldCat, so OCLC, and we put what we can and what we know how to put in. But for the most part, we don't have a specialized cataloging here anymore. And I would hope that you do in more specific terms to help make them discoverable. I think that would be great.
How do you see a small hospital library getting involved in graphic medicine? I
understand you, Martha.
Oh, I'm sorry. How do you see a small hospital library getting involved in graphic medicine?
So, by small, it depends who your primary user group is. So, serving patients or primarily serving the physicians and nurses and doctors? That's my question there. I think it depends on who your primary audience is.
She elaborates with, we have some graphic works in our consumer health collection.
Consumer health collection.
And for both patients and staff.
Okay. Really think, so really what we primarily have available right now. I would say that almost the comics, there's a Word document that will be going around with the recording and the PowerPoint. It's a list of graphics and titles that I'm aware of that would be purchasable for a library. There are others that are zines in small print that just aren't going to be easily found. But we'll go around with the information and should be helpful for collection development. What I'm referring to here is that list is primarily memoirs and things that are consumer-oriented and focused. And so that's where I see the biggest push for this right now, is getting it into our collections that our consumers are using. Just really finding a way to or make people aware of what they are and that they're there. That's really been the hardest part, us here in the academic medical setting, is getting the word out and people in reading something. And I can imagine, your physicians and nurses having an interest too. Maybe they're coming to you asking for resources for their patients, and then I would direct them to, if there's a comic available, recommend that to them, particularly if it's something where they have a family group that they're trying to explain the condition to. With me personally, if I'd had that Painfully Strange book, that would have been the first thing I would have bought copies and gave it to every member of my family to help them understand what I'm going through there. So yeah, that's what I've got for that one. I don't know if it's any help. But.
All right. Last question is, has there been any research into zine or self-publishing culture, mainly online comics, instead of officially published works, with zines considered comics? And this person's special collection is mainly of zines and a center on women's health issues, wondering how these fit into the idea of graphic medicine or if they are something else entirely.
So zines are interesting, and I love them and wish I had more experience with them. Personally, I share with weekly posts if I see news of zines coming out or self-published anything coming out that's even semi-medicine. I include those in those weekly blog posts. Zines on women's health are probably, ballparking it, I would assume that at least half of them have some sort of drawing or imagery to them. My gut instinct is to include them. I'm casting a wide net and an umbrella because, especially for zines that are often overlooked, and no research articles come to mind that have actually included them either. They fly under the radar, and they deserve more attention than they get. My first instinct, hearing that you've got this collection of talking about women's health and knowing that most of them probably have some sort of images in them, to go there and find them and post them, make it a special page, advertise that these zines are here. They talk about patient experience of these women and what they're going through, and there is a comic element to them. I'm not sure I answered that question, though.
We're out of time anyway, so I just want to thank Matthew. And we will be sending around the slides and additional information along with the recording after this is over. But if you have any questions, you can always reach Matthew. His email is matthew.noe@umassmed.edu, and I'm sure he would love to talk to you more about this. So thank everyone for joining us today, and hope to have much more about this in the future. Thank you.
Everybody.